Hi, I'm Dr. Carson Felkel, a child, adolescent, and adult psychiatrist at Secours Mercy Health. And welcome back to this series of brief conversations with Dr. Aimee Drescher, a clinical psychologist in Toledo, Ohio. Today, we're going to continue talking about managing mental health and resiliency during this COVID pandemic, especially as our kids return to school or virtual learning at home. Aimee, some kids have already started back. Some kids are learning from home. How do we manage all of these challenges and create an environment at home to support our kids?
Carson, thank you for having me. That is, a great question. And, we're all struggling to figure out what's going to happen, with our kiddos, as we talked about in our first session. I do think that we are going to see more of the hybrid learning model in general. So we will have our kids learning at home. And I would say that there are some very practical things that we can do to help better support them. First being to come up with a daily routine. When kids have that routine, we can have the structure for them and then teach them elements of flexibility. However, in order for them to be successful, it is really important to have that routine in place. On top of that, I think one of the biggest challenges for parents is just remaining calm throughout all of this. And I would say that modeling calm and confidence that they're going to be successful. So for myself, sometimes I imagine a duck, right? So a duck is just cruising across the water and they look very calm, and then they're just paddling like heck underneath. That I think is one thing that is extremely beneficial for our kiddos. Also to remember that they are often more resilient than we are as adults. So being, careful how much we put our, feelings and anxiety about the situation on them, because oftentimes they are going to handle this a little bit better than we are. So Carson, I would ask you, how are you managing at home and working with your kiddos?
Yeah, so I've got little kids, like I said last time, 10, 7, and 3. And it's really important for me to talk to them and check in with them, but sometimes they don't talk back to me when I want them to let me know how they're feeling. So it's all about playing with them, and that's hard. I mean, I'm home a lot, and so I'm home, but I'm not necessarily emotionally connected and present for them. So my goal is just to have 10 to 15 minutes a day where I can set aside just to play with them on their terms. I'm always helped by this famous pediatrician, Donald Winnicott, who came up with this concept of the good enough parent. He said the good enough mother, but it could be a father, any caregiver. Our job as parents is to create a holding environment where our kids can play in a safe, calm way and begin to express themselves. And that's how they develop positive mental and physical health. We don't have to be perfect. We just have to be good enough. But you've got older kids. How do you talk to teenagers? And when you do talk to them, what are they telling you about their concerns?
That is a really great question too. And one thing I'd like to respond to, you said the good enough parent, and I know I resonate with that completely. Sometimes we put a lot of pressure on ourselves as parents, and it is important to just do our best and create a soft landing and a space for our kids to talk to us. And, where play is applicable to sometimes the younger kiddos, we also have to facilitate, space for our older kids to talk. I often find that mine talk to me when I'm driving in the car because then they don't actually have to look at me. And they just can talk and talk and talk. And I think, knowing your kid and being attuned to your kiddos and creating space where that they are, that they will come to you and talk to you is important. If it's the dinner table, having dinner together, knowing that, they will have that space and that time to talk to you is really important. The biggest concern that my teenagers have right now, both in practice and in my house, happens to be social interactions. And I am sure every teen is going through this right now, where their, social lives right now are very abnormal, and they're very important at that age. So what we are trying to do is really facilitate safe and socially distant communication. As much as I don't love my kids being on social media or being on, the computer play or the, headsets and playing video games with their friends, if that's the social interaction they're going to get, we are trying to encourage that more.
Yeah, that's great. I think if you don't mind, let's talk more about in a future episode how to teach our kids to communicate in this new world of physically distanced yet fully socially interactive environments. It's a real challenge.
Yes, absolutely.
Well, thank you everyone for joining, and more to come on this topic. We'll see you next time.